I think really involving consumers in the design of our services and really trying to listen to consumers, I think, has been really my takeaway. And it was confronting, the consumer panel was confronting for me, but really inspiring for me to really involve consumers in the whole process.
I think the takeaway message for today is basically listening to our consumers, listening to our clinicians, and the barriers which they have in providing better oral health counts. It's a challenge for us during this transition phase from our established practices to move away from that and to implement the value-based care.
I think for myself, the importance of talking to patients, engaging with them in better ways, and their feedback in how they can improve their oral health and just dentistry in general. It's exciting what's to come in the future and what new things we can bring.
I think for myself it's just working more on the preventative side of it. I think a lot of the other conferences or days out in the past haven't really focused on what we're doing. So we're doing oral health education. So I think a preventative side of it is really important for us.
You know, as a panellist there in the last session, I felt very positive about it. I mean, I think the vibe with the whole audience has been exceptional. I think it's fantastic, the message getting out there that we need some change. I think we've had some good speakers from overseas, and it clearly says to me that we're going down the right path, and as far as Dental Health Services Victoria and in the path of value-based healthcare. And I think everybody's getting the message. Some parts of Victoria are further advanced than others in this area, but I think everybody's on the right path, and the message is getting across that we need some change. It's not going to be easy, but it's going to be very good for the Victorian community into the future, those at risk.
It's really great to be here amongst colleagues, and also some new people have come from the outside to challenge us in how we think. So great to have Lynn, who's come from via the UK to New Zealand to Australia, to really challenge us about how we engage. And Norman, as a facilitator, has just been unbelievable with his depth of knowledge of the healthcare system. It's really been great to challenge our thinking, and also to just feel that the work that we're doing is going in the right direction. It's really exciting, and we can just keep on trooping on.
I think the morning lecture, the engagement with the patients, how to involve them in the treatment plan, it was very important. It's very important, and that would be the take-home message.
For me today, as a dental therapist, I'm going to hopefully get use of the silver fluoride, especially with the 3-year-olds. I just had one that I referred the other day to the dental hospital. Same thing, not exposed, not abscess teeth, but big holes, untreatable child. Could have painted the silver fluoride in it, would have all been happy. Come back when they're old and had stainless steel crowns. So I'd love to do that.
The thing that I've taken away is that innovative toothbrush idea, and the amount of sugar that's in products, which is a bit of a horror, especially the cereals.
Yeah.
But I'm looking forward to trialling out that toothbrush idea that they're working on, which is really good.
I think from today I'm going to take away 2 things. One is related to the importance of our consumers and the principle of patient-centered care, how important it is to listen to our patients and make them partners in care, rather than treating them, working with them to address their specific needs. And the second thing I took today is related to the principle of interprofessional collaboration that applies within the dental family, let's call it, where we have so many professionals such as dentists and therapists, and how important it is to respect each other and learn together and come together to meet those patients' objectives. So I think that was a very important lesson that was very well portrayed today.